Namaskar, I am Ashok Vyas. You're watching Vision Asia, Voice of Community on ITV Gold. This Sunday we have many important stories for you. One coming from EWR about Vande Bharat mission. What it is, we'll let you know. We'll also have Dr. Shashi Tharoor, Congress leader, interacting with North American and European Indian diaspora. What went on in that conversation, you'll get glimpses of that part in today's Vision of Asia. We'll also have Council Member Lancman talking to us. An event organized by Shrimad Rajchandra Love and Care to encourage frontline workers at Huntington, Long Island. And then we will have Dr. Dhruv Kazi telling us all about the ideas about future of COVID-19 and our community. We will also have a special this week with Padma Shri Dr. Sudhir Parekh in today's Vision of Asia. All this coming up right after these messages. Stay with us. You're watching Vision of Asia, Voice of Community on ITV Gold. This Sunday, our weekly Vision of Asia brings to you many important stories. We begin with Vande Bharat mission, an initiative of Indian government. Air India collaborated with Indian Consulate to make it happen. Yes, on Mother's Day, back to Mother India. Many passengers were elated in spite of all the concerns of facing hardships of uncertainty caused by COVID-19. Here is a special report from EWR Airport, Vande Bharat mission.
नमस्कार, मैं हूं अशोक व्यास। EWR एयरपोर्ट से एक एयर इंडिया की फ़्लाइट बहुत समय के बाद भारत जा रही है। वंदे भारत मिशन में भारत से बाहर उन्हें फंसे हुए कह दीजिए, अटके हुए भारतवासियों को भारत भूमि तक लौटने के लिए एक विशेष व्यवस्था भारत सरकार की तरफ से वंदे भारत मिशन के अंतर्गत जो की गई है, उसका लाभ लेने वाले जो पैसेंजर्स हैं उनमें से कुछ से हमने बातचीत की।
And I am very surprised and very happy to know that within 12 hours they have, means yesterday I got a call that you have been selected for this, and constantly Indian consulate, they are constantly contacting us, and I remember 8 to 9 calls they did us, and yesterday midnight 12 o'clock my final call was that your ticket is confirmed and you are going to airlift, and tomorrow your flight is on tomorrow midnight, so you have to be there. And I was so surprised that really our Modi government is doing like anything. We are very happy to know that it's wonderful. It's wonderful. I really appreciate this thing that we are going back to our home.
CG Sahab, this is a great sort of initiative on the part of Government of India, this Vande Bharat mission. Talk to me a little bit about the logistics, which cities were selected, and overall approach.
The overall approach was decided between Ministry of External Affairs and our embassy in Washington, and we went through an exercise of knowing who are the people, where are they stranded, what are the geographical locations, what category of people have been stranded. So this went on for some time. We took advantage of the lockdown to make this data available to the policy planners, and then on that basis the destinations were decided, and the originating stations were also decided on that basis. So basically 4 cities were selected: San Francisco, Washington, Chicago and New York, also on the basis of Air India operations, because these flights are chartered from Air India or Air India is running them. And similarly, destination was decided on the basis of our survey that we did. We had the data, we came to know where are the most people here stranded. On that basis it was done, people. So we had a fair idea. देखिए जैसे ही लॉकडाउन हुआ और फ्लाइटें बंद हो गई, लोग हमारे पास आने लगे, तो और हम लोगों का संपर्क भी है कम्युनिटी के साथ, तो वी हैड अ फेयर आइडिया कि किस तरह के लोग फंस गए थे. और हम लोगों ने जब ये पोर्टल एम्बेसी ने खोला जिसमें रजिस्ट्रेशन का, उसमें डेटा जनरेट हुआ कैसे क्या क्या कैटेगरी के लोग थे. एक्चुअली कंपेलिंग रीजंस से ही जाना चाहिए, इन द सेंस कि इंटरनेशनल ट्रैवल रिस्की है इस वक्त. तो लोगों की जो कुछ नहीं कर पा रहे थे, उनको जाना ही था, अनिवार्य था जाना, वही जा रहे हैं। तो वो डेटा है लोगों का, स्टूडेंट्स का है, आपके बीमार लोगों का है, पेशेंट्स का है, जिनका वीज़ा ख़त्म हो गया, जिनकी नौकरी ख़त्म हो गई, उनको तो जाना ही जाना है यहाँ पे। वो लोग मतलब उनके लिए अब यहाँ पे रहना मुश्किल हो रहा है।
Very simple. It was basically there was a link from Washington embassy that came out, and we had to just apply and wait for the embassy to kind of give us a call and see if the embassy can prepare the logistics for us to come and fly from the EWR airport. And luckily I did get the chance to fly from this airport, and it couldn't have been a better Mother's Day gift as such.
जाने का कि यार स्टे करने का जाने का इट्स अ गुड अरेंजमेंट, और वी वर एक्सपेक्टिंग कि ऐसा कुछ हो जाएगा। तो जो इंडियन गवर्नमेंट है उन्होंने ऐसा ही मैनेज किया जो यहाँ पर हम जैसे रह गए उन लोगों के लिए।
वंदे भारत मिशन, वंदे मातरम, भारत माता की जय, ये भाव जागता है उन सभी नागरिकों के अनुभव को सुनते हुए जो भारत माता की तरफ से भारत सरकार की संवेदना को लेकर अपने भीतर एक विशेष उत्साह, आशा और आनंद संचरित होते हुए तो महसूस करते ही हैं, बल्कि उनके अंदर कटिबद्धता भी है कि आने वाले समय में सुनहरे भारत के निर्माण में वो अपनी तरफ से एक आईटी प्रोफेशनल के नाते या एक हेल्थ प्रोफेशनल के नाते क्या योगदान दे सकते हैं, उस दिशा में भी वंदे भारत मिशन का हिस्सा बनना उनके लिए प्रेरणादायी रहा है।
Dr. Shashi Tharoor, an important Congress leader, has always been an active part of NRIs. He himself, having lived in New York for many years, he interacted with American and European Indian diaspora. There were question and answers in this gathering. Here are some glimpses.
You can just talk about the New World Disorder in 2 minutes. It's simply to say that I have written a book on the subject, which was released in January, and it talks about the way in which the system that was set up at the end of the Second World War, yesterday, in fact, is the 75th anniversary of the surrender in Europe in 1945. And in the course of these 75 years, an international order was set up, which is now fraying at the edges before the COVID crisis, thanks to very many countries having turned in the direction of more hyper-nationalism, more ethnocentrism, more xenophobia, and more protectionism. We can talk about that separately, but that's been a global current many of you have seen. And the question that is in some people's minds is with the COVID crisis and people being anxious to point fingers at others. We're seeing, for example, Mr. Trump taking the opportunity not just to criticize China, but even, as you know, to attack the World Health Organization. And the real question that comes up then is, how do we actually manage to run a world system in which more and more countries are retreating behind their nationalist sovereign barriers? I hope that India will be a constructive voice for more international cooperation, not less. That has been our instinct throughout, and my hope would be that we will indeed approach it in that spirit in the time to come. But answering what Samji started us off with on the situation in the country, we have now been under lockdown since the 24th of March, which is certainly less time than Sam has been under lockdown, and some of you in America have been locked down for longer. But in India, it has been recorded and described around the world as the most stringent lockdown on the globe. We did see a lot of reaction. The biggest complaints that we had, and I'm going to try and keep it brief because I think your questions are the main purpose of this exchange. But let me say, if I were to speak personally and as a Congress MP, I would say that one concern I would have had from the very start is that the lockdown came initially a bit late. I had been calling for one on social media at least 10 to 12 days before it happened. Rahul Gandhi had said in early February, on the 12th of February, that the government was not taking COVID seriously enough. The government at that point was focused on the avoidable distraction of the Trump visit at the end of February, and subsequently on the other distraction of bringing down the Congress government in Madhya Pradesh, which happened on the 23rd of March. So they wanted to convey an illusion of normality until then, including keeping parliament going so they were not under any pressure to shut down the Madhya Pradesh legislature. The result was that the country was locked down later than it should have been, number one. Number two, it was locked down at ridiculously short notice. The Prime Minister gave the people of India 48 hours notice to just have a Sunday curfew, a Janta curfew on a Sunday. But then he gave the nation on the next Monday, he gave them 4 hours notice to lock down for 21 days. And the problem with that is so little notice means people couldn't make any arrangements. Employers couldn't make arrangements for their employees. Factories couldn't make arrangements for their workers. And migrant workers who needed to go home because they no longer had a job or a daily wage or a roof over their heads, they had no means of transport because all trains, planes, buses, interstate travel were shut down, highways were closed.
My question is concerning Indian international students in Canada and across the world. Canada itself has over 200,000 students from India and more who have graduated in recent past. It's fairly safe to say that most of these students are financially supported by student loans from India. Is there already or will there be any provisions for an interest-free deferral of loan payments during this COVID-impacted time period?
Excellent question. Thank you. And we have, in fact, recommended that. We believe that, first of all, loan repayments need to be deferred, not only for students, I might add, but also for small businesses and others, including people who've just taken home loans, car loans. Ideally, the loan repayment should be deferred for about 3 months or as long as the virus emergency lasts. But then if at the end of the 3 months, everybody has to pay accumulated interest, that's going to be a bigger blow than if they pay what they can right now. So we have asked for the interest to be waived. I think that's a loss the government should be able to subsidize with the banks. The government should be able to bear this. Every government has more resources than they like to admit. In India, for example, they have raised the excise duty on petrol to a staggering 13 rupees per litre. In other words, now when you go to the petrol pump, the gas station, as you would say in North America, something like 67% of what you're paying is just excise duties to the government of India. Now, where is all that money going? It should be used to do things like this. Protect our students, protect our businesses, give some support to wage earners, buffer them so they can then come back and be economically active as soon as the emergency is over. So, Mohammed Roshan, I'm with you on this suggestion, and we will continue advocating.
Reverse inflow of urban immigrants will cause much social pressure in our rural areas with regard to employment and life-sustaining activities. How can the social engineering coupled with the social banking give a new life to the suffering teeming millions in our rural areas, especially that of contest-run states? Thank you.
Good question and a very tough one to answer, because some of the reverse migration you're talking about is of people who left in the first place for the urban areas because they could find no work in the rural areas. And these are people who are working in daily wage professions, rickshawalas, chai sellers, domestic helpers, factory hands, and so on. Obviously, you can do those professions in cities or where there are large numbers of people, but you're not going to make a viable living trying to do those things back home in the villages. The only answer, as I said at the very beginning of this Q&A, was to follow Dr. Abdul Kalam's advice and increase the provision of urban facilities in rural areas through extensive building up of rural infrastructure. Electrification is one thing, but also dramatic expansion of broadband, so that a lot of jobs that could be done virtually don't need to be done in congested cities and can be done in rural areas. As for banking, I'm not sure I fully understand the term. The Congress has recommended the sort of Nyai scheme, which will ensure that there is a basic minimum wage, a basic income given to the poor, so they can start generating their own lives without worrying about whether they can afford to eat today or sleep under their home roof. That kind of subvention is the only answer to deal with this in the rural area.
The area which is badly affected by COVID-19 in Queens is represented by Council Member Lancman, and he has some direct experience of having seen ground realities and having interacted with people. What are the challenges, how we are coping up, how we are moving towards a better New York in this part of New York. Let's hear Council Member Rory Lensman.
So much, Council Member Rory Lancman, for joining us on ITV Gold. You know, just beginning this interview, I have to ask you the biggest question of the hour: reopening of New York City. What is your take on reopening, and what is the vision of the New York City Council? What should we know about this as New Yorkers?
Sure. Well, I can only speak for myself, of course, and on behalf of the 160,000 residents of the 24th Council District. I have a lot of ITV viewers, especially in the Jamaica Hills, Briarwood communities, and it's nice to be able to communicate to them and to your audience. I think we need to be very, very cautious about reopening. We have seen in other countries where they have reopened prematurely, and as a result, there have been spikes in new coronavirus infections, and I think that we've seen that elsewhere in the United States as well. And so, I thank God I'm healthy. My family's healthy. We've been through whatever we've been through. We are managing. It's very hard. It's particularly hard on people who've lost their jobs and our frontline workers. But it would be a tragic mistake where we have successfully flattened the curve in New York if we were to prematurely get back to our lives and reignite the coronavirus amongst us. I don't see us doing a broad opening measured in weeks, more like months. But I think you will see a piece by piece and just seeing how each piece develops.
Let's talk about District 24 real quick here. It has one of the most populous communities of South Asians, and it also has a lot of Indo-Caribbeans living there as well. Immigrant communities are really at the heart of this epicenter pandemic in New York City. What have you seen in this entire process of COVID-19 impacting the immigrant communities, and what resources are now available for them?
So, it's really tragic that our immigrant communities have borne the brunt of the coronavirus pandemic. And it comes from a number of reasons, including people living densely together, lack of access to healthcare. That lack of access to healthcare has also created somewhat of a reluctance on people's part to seek out healthcare because they can't afford it. So many of our immigrant neighbors and friends and constituents are in the industries that keep them on the front lines, whether it's healthcare or the service industry, in restaurants, in civil service jobs like working for the MTA. And so the immigrant community, whether it's in my district, in Jamaica Hills, or in Corona, or in other parts of the city, have been particularly hard hit. And we've tried to ramp up our support for those communities, whether it's in terms of food pantries or access to healthcare services. But there's just no getting around it. The immigrant community has borne the brunt of this crisis.
How do you hope to resolve some of these issues in the next few weeks?
Well, I don't. I mean, I wish I could, but I don't. These are systemic, deep-rooted problems and inequities and realities in our system. And right now, we are trying to cope with them through Band-Aids. And as I said yesterday in a different interview setting, I hope that we learn our lesson from this crisis, and a lot of the things that we are doing as Band-Aids become more full-time policy, making sure that everyone has access to affordable quality healthcare, that immigrant communities have organizations that are culturally competent that they can reach out to for information, for guidance in how to get services. that we have a system of unemployment insurance and other supports, social safety net supports that people can rely on in times of crisis, but just in people's everyday lives, which are hard enough.
Council member, you sit on the Committee of Justice System and as the chair for that. And this entire scenario of COVID-19 has really brought in this fight for justice and how justice has to be served no matter what. We're seeing a rise in crime. We're seeing a rise in domestic violence, especially in New York City. What do you have to say about your own observance of this? And what does the council need to do to attend to these issues of crime and violence increase during this pandemic?
Well, so you look at the justice system. First thing that comes to mind, of course, is the criminal justice system. And we, and I say we, the council, I think played a very, very important role in trying to get as many people out of Rikers Island as possible, consistent with public safety, to protect the people, the detainees, the inmates, the civilian staff, the correction officers. And I think that the city did a very, very good job of that. And if you look at who's sitting on Rikers Island, let's just say that people of color, the immigrant community are sadly overrepresented in our criminal justice system. But we also need to focus on the civil justice system, the things that people can find themselves in a courtroom for that is not, they've been accused of a crime, but they might be at risk of losing their apartment, being evicted from their apartment, or having their home foreclosed because they can't pay rent, they can't pay their mortgages. People who are at risk of losing custody of their children, people who have to go to court to be able to get benefits that they're entitled to. The whole civil justice system has, for the most part, frozen during this crisis. And this evening, I don't know when this is going to air, but Thursday, May 14th, 6 p.m., we are having a virtual town hall with civil legal services providers to answer people's questions on immigration, family, housing, elder law, other matters where if you don't have a lawyer to represent you, you can really be out of luck.
Yes, definitely. And I think that's so important for the community to know, especially the ones that are suffering. Do you have a message for people that are suffering and they really need help? How can they reach out to your office and how can they go about really seeking help?
Well, first, let me say to everyone who's suffering, and particularly to people who've lost someone to the coronavirus, how profoundly sorry I am for your suffering. The truth is, all of us have known somebody, either very, very close, intimately in our family, or close enough, who've been lost to the virus, and it's just terrible. It's devastating. It's impossible to make sense of. But know that at least your government here in New York City, all of your council members, your assembly members, your state senators, your governor, your mayor, we are all fully, completely engaged in trying to help people. Not all our decisions will be correct, will be wise, will end up being right. But we are here for you. For me in particular, you can reach my office, 718-217-4969. My whole staff is working remotely. You can email us, rlanceman@council.nyc.gov. You can find me on Twitter. You can find me on Facebook. We are here to serve you and to help you. And if you think you're feeling alone and feeling desperate, you will be shocked to learn how much is here, both from the government and from nonprofit organizations, how much is here to help you. So reach out to us.
Shrimad Rajchandra Love and Care also hosted a motorcade. They organized distribution of masks and other important items for those who are frontline workers. Their participation included the presence of police department and fire department also. Here are some highlights from that event.
Shrimad Rajchandra Love and Care is inspired by Shrimad Rajchandra ji, who was the spiritual guide of Mahatma Gandhi. And You know, one of the main tenets that we learn is to make sure that we do everything based on compassion. One of our mission statements is to realize one's true self and serve others selflessly. So serving others selflessly is that compassion in action. And when we really see all of the different things that people are going through and what people are doing and how much they're doing to impact the community, it is our responsibility to make sure we recognize the good work they're doing.
सहजात्म रूपी सेव्य गुरु ने वंदना विधिये करूं सहजात्म रूपी सेव्य गुरु ने वंदना विधिये करूं वंदना विधिये करूं वंदना विधिये करूं.
Inspired by Pujya Gurudev Sri Rakesh Bhai, Shrimad Rajchandra Love and Care initiates a unique 360-degree program of support and extension, relief and aid, working for multiple causes at multiple levels in just 21 days. Using a global network of centers and volunteers across 5 continents, in numerous cities across India, the United States of America, Canada, United Kingdom, UAE, Singapore, Australia and Kenya.
And in the end, I hope that this COVID crisis becomes a reason for all of us to get unified, all of us to get united and come together as one and become one community and not be divisions of a separate community. So we really believe that the Indian community is a critical part of that. We really believe that Shrimad Rajchandra's teachings have always taught us to really bring all of our groups together, and we really want to make sure that that is something that we present in action and make that happen to bring all of us in one. Right now in the world, there's so much negativity, so many things that are going on, and hopefully people can see some inspiration and positivity in all the beautiful work these frontline workers are doing, and that will bring some positivity so that when we come out of this, we all remember how to serve each other well.
Oh, there's never enough thanks, but it's days like today and our friends in the Indian community that have come out and to show their support. You know, this is not an event that just affects New York State. It's a worldwide pandemic. And the good that comes out of something like this is we all come together to celebrate what's important, people's lives, to celebrate what's important. Those frontline workers that are in that building right there taking care of our loved ones, they don't have the option to stay home and shelter in place. They're out here every day taking care of the people we care most about. So I want to thank you for coming out and being part of the solution and helping so many people know that people care out there for the work that they're doing day in and day out.
What is going to be the new normal? Will we all move past COVID-19, not knowing anyone close to us, having faced the ordeal of being affected by COVID-19? Dr. Dhruv, Kazi feels the other way. He thinks that over time, all of us will know someone affected by coronavirus. Here's a part of our conversation with Dr. Kazi.
Dr. Dhruv, Kazi, thank you so much for being with us on ITV Gold. How are you doing today?
I'm well, thank you. Thank you for having me.
You know, Dr. Kazi, just beginning this interview, I kind of want to reflect on the numbers that are coming in as of Monday this week. We're looking at over 4.1 million cases globally of COVID-19, more than 282,000 deaths globally. In the United States, we're looking at 80,000 deaths, as well as over 1.3 million cases. Looking at these numbers and how large, the number itself is, how should we process this, and what should we know about these numbers to truly understand what they mean in a global perspective and in a national perspective?
Yeah, one of the comments that has stuck with me over the years is that a single death is a tragedy, but a large number of deaths ends up being statistics. And I think we should avoid that problem. Like, it's important for us as we plan for this disease staying with us for the next many months and possibly years, to remember that the 80,000 Americans who've lost their lives are people with stories and lives around them. And certainly in parts of the country that have been very hard hit, that's a message that will resonate. What does it mean for folks who have not been directly affected by the disease? And I would hazard that over time, all of us will know someone in our personal lives who's been touched by this condition. But even among those who have not, it's important for us that we have to do our part to make sure we are not vectors for the disease. So if there are social distancing guidelines, if your community requires you to wear a mask, requires you to stay at home, even if you're younger and healthier and unlikely to catch the disease, we now know how easy it is to transmit the disease to older adults, and it might be devastating for them. We've also seen very severe cases in younger adults, even though they're uncommon. We've seen young adults end up on the ventilator, in the ICU, do poorly. And so I think that it's important for all of us to play our parts in keeping this disease under control.
You know, we keep on hearing in terms of COVID spread that we are reaching the flattening of the curve in multiple states. I know you're right now joining us from Massachusetts. We are here in New York City. Could you describe to us what exactly is happening in terms of flattening? And my question to you really is there an actual decrease in the number of deaths? Because, you know, at the end of the day, that's what most of the community is concerned about, to have a decrease in that.
Yeah, so I'll tell you that from the perspective of Boston, Massachusetts, we have seen flattening of the curve in action. We had our first cases at the end of February, and the city, particularly Boston, almost immediately shut down, put shelter-in-place orders. And we had been pretty much shut down for 5 to 6 weeks before our cases started climbing. Which is, of course, different from New York's experience. Our cases climbed slowly. It gave us, our hospitals, time to prepare. Your audience will be aware of the fact that Boston is a very medical-centric city. We have a lot of hospitals, a lot of top-notch hospitals. And so we have a lot of reserve capacity. And we were able to use that reserve capacity for ICUs. To give you an example, our hospital, it's a 600-bed hospital, typically has about 70 ICU beds, and we doubled our ICU bed capacity to 140 over time. And because we didn't get a tsunami of admissions, we got the slow wave of admissions that we saw all over Boston and Massachusetts, we had the time to prepare for this. What does that mean? It means that we were able to provide ICU care for all of the patients who need it. And ICU care is not just about creating rooms, it's about making sure there's nursing, there are doctors, there's ventilators, there's all of the other support that goes into creating an ICU room or bed. And we would not have been able to do that if all of the patients who we eventually took care of had arrived on day one. So flattening of the curve is mostly because it allows hospitals like ours to prepare for the patients who are coming in. And I will tell you that I am very grateful for everything that Bostonians and the state of Massachusetts did to make sure that all of these patients didn't show up at the same time. In the long run, of course, we think that that saves lives, because when hospitals are prepared for patients and have the time to create ICUs, we can deliver better care.
In terms of critical care, Dr. Kazi, since we're talking about it, you have expertise in cardiology as well as you're working in the ICU. So you're pretty much you're on the front line here in this crisis. How has critical care changed in terms of patient care and patient taking? And what are some of those challenges you're currently facing, in your space at the hospital?
Yeah, and I would say that, so as you know, COVID is an interesting disease because it's, for the majority of patients, it affects a single organ, the lungs. And then in some patients, it involves a whole bunch of other organs, including the heart, the vascular system. There's evidence that the brain might be involved, other body systems getting involved. So as a cardiac critical care person, I'm seeing a sliver of the sickest patients who are not only in the critical care unit, but they've also had their heart involved, for instance, or there's concerns that their heart is involved. And the experience of our hospital has been unique because we had the time to prepare for it. Even so, I shouldn't sweeten the pill, so to speak. It was hard. It was hard to take care of a large number of patients, and we are really grateful for the fact that the numbers appear to have plateaued. And that's important for us to understand, that people who end up in the ICU are in the ICU for weeks. And so even when the curve starts to slow down, the actual number of patients in the ICU stays high until it eventually drops. And so we're at that peak plateau stage that we're grateful that the numbers aren't rising. And it would, based on conversations with colleagues in Boston and in other hospitals in Boston and in New York, we've seen similar experiences. The other thing I would chime in here is that all of the hospitals in the US saw this other pretty interesting observation, which is that there was a dramatic reduction in the number of heart attacks and strokes that were coming into the hospital around the time that COVID was unfolding. Now, we don't expect COVID to protect you from heart attacks and strokes. And what was clearly happening is that people were trying to avoid hospitals. And there were, we were worried that there are folks who were having heart attacks at home or small strokes at home and not seeking care. We have data suggesting that that was indeed the case, both in Boston and across the country. What we're seeing now that the peak of the COVID pandemic has passed is we're seeing that those patients are coming back in. So we're seeing a lot more heart failure, a lot more heart attacks and strokes, people who were avoiding care in the past who are now back to receiving care. And so I think it's really important for folks watching this at home to understand that as much as our ICUs and hospitals are busy taking care of patients with COVID, they are prepared, as they always have been, to take care of people with heart attacks and strokes. So if you feel like you're having chest pain, you're having shortness of breath, you might be having a stroke, don't sit it out. This is the time to come into the hospital, because those things continue to remain life-threatening, and hospitals are prepared to safely provide care for you without actually increasing your risk of getting an infection.
Prime Minister Narendra Modi addressed Indians again, and this time giving them hint for extension of lockdown period, but with new shape, new set of rules. What that will be, details will be announced later when it begins from 18th May. He also announced a big stimulus package. So the overall stimulus package now ranges 20 lakh crore rupees. How things are happening in terms of revival, we talked to Padma Shri Dr. Sudhir Parikh in This Week with Padma Shri Dr. Parikh. Take a look. Namaskar, I'm Ashok Vyas, and I'm delighted to be welcoming Padma Shri Dr. Sudhir Parikh to this weekly show. And I recollect his immense contribution towards bringing America and India closer. And as we are on the threshold of revival, we will be talking to him about the recent address of Prime Minister Narendra Modi. Dr. Parikh, welcome to this week's show with you. Namaste.
Namaste. Namaskar.
So, Doctor, I'm sure you must have paid attention to the recent address of Prime Minister Modi yesterday.
Yes, yes.
So what do you think was the key point which was highlighted by him?
Well, I mean, what he is saying that reopening of the India in such a way to, and also the boost the economic revival of the India. And that's why he kind of announced a very big, large package, almost 20 lakhs crore rupees, I think, if I'm not wrong, to stimulate the economy, just like what Trump administration did here by giving that PPP loan to all the small businesses, provided they maintain their staff and employee for next at least 3 months till everything gets going. And I think what Prime Minister Narendra Modi has very nicely put that to revive the economy, you have to come up with a certain projects like infrastructure and other project to stimulate the economy. And once the economy gets stimulated, there will be a trickle-down effect, and everyone, all the classes of the society will get the advantage and benefit of it.
I think the way he started off, as always, he comes across as an inspiring speaker. He talked about giving importance to local businesses, and he said that let us be vocal for the local. What do you think about this idea of moving towards self-reliant India, Atmanirbharta, as was mentioned by him again and again?
Well, that's what I'm saying. What he's trying to do is he's trying to take a, a kind of blessing in disguise, in a kind of thing, because even this COVID situation is very, very horrible and very unfortunate. But he's looking a silver lining out of that and make India a more manufacturing hub, and bringing the China supplier manufacturing and all the supplies of the world, part of it to the India, and boost the Indian economy.
So talking about the significance of this package, and he said that finance minister would be giving the details about the allocation. He didn't get into the details himself during his address yesterday. But again, he said, be vocal for the local, and then local can go to global. So his choice of words is very apt, as always, and he comes across as an impressive speaker. So that is one side. But there are many critics who say that he was short on giving exact details and the roadmap. What do you think about these both sides?
No, I mean, as a prime minister, I think he has to give only broad outline of whatever this stimulus package is and what this stimulus package will do to the people at large. He does not need to go into too much detail. So I think that criticism is unwarranted. And of course, that is a job of finance minister. And I think this morning I glanced at finance minister's speech, and she was giving very detailed and where the money will go, how much to infrastructure, how much to healthcare, how much to manufacturing, and whole idea is to attract the foreign investor in India, to boost manufacturing in India, and make the India like another China, where they can supply all the supply chain to the globe world.
So on the one hand, it looks like India has certain advantageous points with the overall politics of the world, China's position, many countries not looking at China favorably, and probably India is likely to be the next destination for many entrepreneurs. Do you see that happening in near future, Doctor?
Well, I mean, theoretically, India is the ideal location, ideal place to be whole world to go. because India has a large young population, India has very intellectual population, and India has very educated population too. And for any kind of manufacturing, I think India can be very useful. Plus, as compared to Western world or developed countries, India's manufacturing in India, just like China, is much cheaper to the international companies, and therefore I think India is a very ideal location, ideal destination for foreign investor.
And also, India has shown its manufacturing capacities by coming up to the challenge and starting recently, as is the need, 2 lakh PPE every day, as well as 2 lakh masks every day.
Because India has manpower. See, when you have manpower, when you have know-how, or you have young population, 80% of the people are young population who can work hard, I think India is the right place for this kind of foreign investor, as well as a supply chain manufacturer.
Another thing, globally speaking, there are many Indians who, of course, the whole world is a village nowadays. So I personally got the opportunity of talking to many Indians who were evacuated by Air India and Government India's efforts, and they were very appreciative of this gesture and the considerate approach of Modi government. It's a massive operation, many countries, Indians coming back. What do you think about that side with respect to Modi government?
Well, I mean, our publication this week, yesterday in Desi Talk, we did a cover story on this homegoing. You know, it's called homegoing, and I think India has done right thing, because all the citizens of any country, the government of the particular country has obligation to bring those citizens back home if they want to come home, because at the end of the day, your home is wherever you are citizen. And I think what government of India has done is an excellent plan, and brought so many, and still bringing so many the Indian citizens from all over the world, including USA.
And let me share, probably you're aware, but this Prime Minister Care Fund, which was launched, and it has collected quite a bit of funds. It has allocated 2,000 crore for purchasing ventilators and 1,000 crore for migrants. So these migrant workers, that problem seems to be coming from almost all the states. How do you see the efforts in terms of coordination between state and center? Because you will read in coming days also many dissatisfying experiences of people for obvious reasons.
Well, I mean, for obvious reason, you cannot do the perfect planning. But I think this is a great gesture by Government of India to the migrant, because migrant are also our brothers and sisters, and they have every rights what upper middle class or rich people in India has. Because India is not only for well-to-do people, but India is also for people who work for you, and who work in the real estate industry, who works in the manufacturing industry, who works in the auto industry, and those migrants and those people, those who are daily wager, it's very important for economy of any country. And I think to take care of them, it's really both. It's economically is very smart thing to do, as well as it's a very humane gesture, which one must do. Because after all the people of India are equal.
And lastly, Dr. Saab, as everybody is eager to go back to the normal life, which is going to be a new normal, and some people become complacent when they see that things are not as alarming as they were. So I would request you to repeat the precautions that still need to be sincerely observed, and anything in the direction of opening up that you foresee.
Well, I think opening should be done slowly and methodically, because virus is going to hang around for a long time. And so now, in last 2 months, we all learn how to live with the virus, in a sense that we must wear the mask when we are in the public. We must keep our personal hygiene, and keep the social distance. If you do these three things, probably chances of catching the virus is very, very small. So if everybody acts the responsible way, everybody acts the way they should, according to guideline, I think we can open very easily and successfully. And then future nobody can predict. And so we have to, I mean, we had this kind of pandemic 15 years ago or 16 years ago. And that pandemic, again, as you know, that SARS never came back. So you never know how this virus will act. I mean, it may come back, it may linger around longer, or it may not come back. So there's no way to predict. No scientist can predict this thing. I mean, we can. So I think we should be calm, composed, more practical, and less fearful. And we should go back to normal, but it's a modified normal. And as long as we do that, I think in next few months we'll be back to a kind of routine.
So your last remarks pretty much are covered, but I would still request you, anything that you would like to add as you say goodbye from today's show?
Well, dear friends, again, we are passing through a very horrible pandemic. We are at the end of the pandemic. We dealt with more or less successfully, whatever possible. And I think India has done great mitigation, and we must congratulate the Prime Minister and his government for that. And let's be safe, keep social distance, wear the mask in public, and keep the aggressive physical own personal hygiene. And if you do that, you will win. And so after saying that, let me say goodbye to you guys. We'll see you next week. Jai Hind. God bless America. God bless India. Thank you. Bye.
Here is a gentle reminder, do become friends of ITV Gold Facebook page, subscribe to ITV Gold's YouTube channel, and also write to us, keep writing to us those wonderful letters, events@itvgold.com. Stay safe, stay healthy. Thanks for joining. This is Ashok Vyas saying goodbye from this week's Vision of Asia, a voice of the community. Namaste.